no surprise, Baltimore residents eagerly offered input during more than 36 community engagement sessions throughout the spring. Thanks to the leadership of the Mayor's Office of Neighborhood Safety and Engagement, or MONSE as we call it, and the Baltimore City Health Department, their feedback is reflected in this plan. And that's why this plan is not just my plan. It's Baltimore's plans. It's our plan to deal with the disease of gun violence. Never before has Baltimore developed a holistic violence prevention strategy, one that aims to treat gun violence as a public health crisis, one that operationalizes what Baltimore residents want to see from their city government. Baltimore has also never developed a multi-year plan to reduce violence in a sustainable way over time, not just from year to year. That changes now and forever. Let's be clear. Today doesn't mark the beginning of this work. Since taking office in December, my administration has been laying the groundwork for this plan in many ways. Of course, by establishing the Mayor's Office of Neighborhood Safety and Engagement, which will be a key partner and my key partner in the coordination of this plan. We have initiated a citywide 911 call diversion pilot program, a clinical government partnership that ensures we send the most appropriate resources when our neighbors call for assistance. We are now weeks into its implementation, and we are already seeing promising results, and I look forward to building on, accelerating, and expanding these efforts. We also established a partnership with Everytown for Gun Safety for a first-of-its-kind data portal that provides a near real-time view of the city's gun trafficking data, allowing us to better hold accountable and seek out those who are bringing weapons into our streets via trafficking or straw purchasing, allowing our firearms intelligence unit to partner with our partners at the ATF to bring these folks to justice. We also introduced legislation to reduce the number of false alarm calls that require police response so that our police officers can do exactly what our residents want them to do and not just be responding to false calls. We also have re-established the Criminal Justice Coordinating Council so that we can put to bed the debates, that we can all come together, local, state, and federal partners, and have a forum to share information, but more importantly, to hold each other accountable and better align in our shared fight against violence in Baltimore. And we look forward to using that to improve coordination on all levels. We also started to lay the groundwork and the foundation for our group violence reduction strategy, working in partnership with the police department, the state's attorney's office, to make sure that this time Baltimore actually gets it right, that we don't walk away from a group violence reduction strategy, that we do the work that we know will reduce violence in Baltimore. And of course, we train city leaders and employees in trauma-informed approaches and officially swore in our city's inaugural trauma-informed care task force, which will also be a key partner in this work. We did not wait. I'll say it again. We did not wait for this plan to be finalized before we began this critical work. This sense of urgency will continue to drive the way that this administration operates with regard to violence. This violence prevention plan is an affirmation of my commitment as your mayor to a new comprehensive and coordinated approach for a much safer Baltimore. Building public safety, not creating, building public safety with our community is intimately connected to the work of prioritizing our youth, of equitable neighborhood development, of clean and healthy communities, and the responsible stewardship of public dollars, my driving priorities. This will be something that my administration will not do alone, but that we will do in partnership, first and foremost with our residents, city agencies, the city council, our state partners, local organizations, the business community, and our federal partners. Now, let me also be very clear about this. I am not naive to the work that we have ahead. This is a lot of work for all of us. We understand that no single policy or initiative serves as a cure-all for the long legacy of violence that Baltimore has endured. There is no silver bullet. However, I believe wholeheartedly that this transformative approach can move the needle and make every neighborhood in Baltimore a safer place to live. Historically, city government has shied away from setting ambitious goals to reduce violent crime. I believe setting strong goals, and pushing my entire administration to work with complete focus, dedication, and accountability to achieve them is the only way to operate. What we are striving for in the successful implementation of this plan is a reduction of violent crime by 15%, in addition to making Baltimore City a city where everyone feels safe. This work will be driven by a sense of urgency and a commitment to making improvements along the way while building systems, structures, and relationships necessary for the successful implementation of this 5-year plan. I would be very remiss if I did not uplift the work of our health department and the leadership of Dr. Jaraza, who played a formative role in developing the public health framework that underpins this plan. Dr. Duraza last year convened an entire task force of public health and agency experts, and this work would not be possible without those efforts. While she could not be here with us today, as of course she is dealing with the other pressing pandemic in Baltimore, I want to thank the health commissioner, her entire team, and all who participated in that process for their partnership and for helping my administration hit the ground running from day one. The last thing that I'll say before I turn it over to Director Jackson is this. We are here today at the Rose Street Community Center for a reason. The work that Mr. C and his team do on a daily, and I mean daily by 24/7 basis, embodies what's at the core of this plan and the work that my administration will continue to do and build on in partnership with our communities. Organizations like Rose Street that engage in conflict mediation, who intervene in violence, are a critical part of a public health approach to violence and our strategy for a safer Baltimore. I look forward to continue to discuss this strategy with you, work in partnership, and report on our progress. I'd like to now turn the mic over to Director Jackson to discuss the importance of the first pillar of our comprehensive plan, a public health approach to violence. Director Jackson?
Thank you, Mayor. And my Mr. C voice for all who know. Good morning.
Good morning. Good morning.
First, let me thank Mr. C and Rose Street Community Center for hosting us. The work that you do here and for this community is undeniable. It's by definition the application of a public health approach to violence, and that's what the first pillar of the Mayor's Comprehensive Violence Prevention Plan is all about. Thanks to the work that Dr. Duraza coordinated with the Violence Prevention Task Force, we were able to create a plan that will employ approaches that provide the maximum benefit for the largest number of Baltimoreans, regardless of their age, race, gender identity, sexual orientation, or their zip code. This is what a public health approach to violence is all about. It's about simultaneously addressing gun violence and unearthing its root causes. We can't trade one for the other. We don't need to, and this administration won't. Pillar 1 is made up of 5 components: gun violence prevention, victim services, youth justice, community healing and trauma-informed practice, and reentry. For the sake of time, I'm only going to highlight 3 of them. For returning citizens, Baltimore's got to do a better job at providing services to people who are returning home from prison, and this work has to start prior to their release. To do this, the mayor will establish a reentry action network made up of returning citizens, direct service providers, funders, and others to prioritize reentry as a successful movement into the creation of safe spaces and safe return plans for incarcerated individuals. In fact, we've already begun working on an initiative with the Department of Public Safety and Correctional Services, the Mayor's Office of Employment Development, the Department of Public Works, and Baltimore City Parks and Recs that will allow folks to begin to work jobs in the months prior to their release. The community healing and trauma-informed practice component is about integrating trauma-informed approaches and building community capacity to self-heal and to be the co-facilitators in each other's healing. This work is going to involve training residents in trauma-informed approaches, implementing a coordinated neighborhood stabilization response when traumatic events impact our neighborhoods, promoting mediation services to resolve conflict, expanding community-based supports for folks who are dealing with active opioid addiction, scaling up 911 diversion, and other things. It also means that the mayor will be removing barriers to city government employment. Specifically, Mayor Scott will suspend pre-employment drug screens for jobs in non-safety sensitive positions. He's also directed the Department of Human Resources to make sure that we're compliant with the Ban the Box law that passed last year, and that we are not using people's criminal background checks as a way to exclude them from every city job. The last component that I'll talk about is gun violence prevention. In the past few months, the mayor has demonstrated his commitment to stemming the tide of gun violence in our city. He's done this by being the first mayor to partner with Everytown for Gun Safety to create a data portal that gives us a near real-time view of crime gun data. We've done this by taking down a major gun manufacturing ring in Northwest Baltimore earlier this month. As you heard from the mayor, we'll be doing work by expanding our community violence intervention programs because we know that building an ecosystem for communities means that they've got to be equipped with the resources that they need to send credible messengers who live in their neighborhoods to interrupt violence in real time. And last but certainly not least, in the coming months, we'll be piloting the group violence reduction strategy in the Western District. This partnership with BPD, the state's attorney's office, and agencies at the state, city, and federal levels will allow us to focus on those individuals who are the most violent in our community. We'll be giving them two options. One, keep doing what you're doing, and we're going to bring the entire weight of the city, state, and federal resources down on you. The major takedown of Triple C a few weeks ago is a demonstration of what that will look like. Or two, step away from the life, and we'll provide you with full wraparound and community-based supports to do that. To demonstrate our commitment to this, Monty recently awarded Youth Advocate Programs a $1.2 million contract to provide these services during the pilot. We've just completed our problem analysis in the Western, and we're readying Monty and BPD teams to hit the ground running. To talk more about GVRS, the work that they've done to prepare, and the work that lies ahead for BPD, I'll turn it over to Commissioner Harrison. BC?
Thank you, Director Jackson. And good morning, and thank you, Mr. Mayor. And thank you, Mr. C, for hosting us. BPD is proud to support this comprehensive violence prevention plan as an ongoing partner in reducing crime in Baltimore. Since my arrival, I have fully recognized that the path to successfully reducing violence involves more than just enforcement alone, because law enforcement cannot do it alone. This plan involves a comprehensive strategy that focuses on key areas to include prevention, intervention, rehabilitation, reentry, as well as enforcement. This is about breaking the cycle and culture of violence in our city, rather than the sole reliance of using police deployment alone to attempt to prevent it and then apprehending people when they commit it. Our department stands ready to fully support this plan, combining effective policing while using these additional assets, which enables us to strengthen relationships and build trust with the communities we serve. Embracing new partnerships and technology have been a cornerstone to building a more efficient agency that's better organized and coordinated with our partners. These technology enhancements have enabled our department to set up the Firearms Intelligence Unit, which uses a customs intelligence tool that integrates gun violence data to investigate straw purchases, problem dealers, and other sources of illegal guns, which allows us to target gun traffickers. Additionally, our department has been working with the mayor's office, as well as with our local, state, and federal partners in laying the groundwork for the group violence reduction strategy, as you just heard Director Jackson mention. This strategy not only requires a strong collaboration for enforcement, but also communal partnerships in providing pathways away from violence to many of our at-risk individuals. This new comprehensive plan, along with our department's community policing plan and neighborhood policing plans, are all about co-creating public safety strategies with our residents that not only work to transform our department, but our city into one that our community wants, needs, and most importantly, deserves. So I want to again thank our mayor on his leadership in looking at crime, not just through public safety lens, but also as a public health emergency. And together we'll accomplish the goal of making Baltimore City a safer place for all. Thank you. At this time, I'll turn it over to our state's attorney.
Give her a hand.
Good morning. So first and foremost, I want to say thank you, Mr. C., Mr. Mayor, all of my colleagues for their leadership. This is about partnership and collaboration. That's the key to transforming the trajectory of our communities. The Violence Prevention Plan emphasizes community engagement, public health, and safety. It is our hope that this new unified, and I need to emphasize that word, unified approach will yield the results that we all want to see, which is in the city that we love, less violent crime and less homicides. I understand some who may yawn at the thought of yet another violence prevention strategy. We've tried these approaches in the past, but it was instability in the city leadership that was always a cost to us. In the last 6 years, our city has had 4 mayors, 5 commissioners, and with that instability and diverging approaches contributing to the lack of sustained strategy on violence. Now this mayor, Mayor Scott, the commissioner, and I, our federal partners, our community partners, are all philosophically aligned when it comes to crime and holistically attacking the root causes of crime. We all know that the status quo, the zero tolerance policing, the broken windows theory, that has not worked. It has failed our communities and engendered a deep-seated mistrust, especially among Black communities and law enforcement. We know we cannot simply arrest and incarcerate our way out of the violence, and thus we need a multi-pronged, collaborative, unified, and data-driven approach that engages the best from our communities, our civil society, our academics, the service providers, outreach workers, and government agencies. We cannot do this alone. Gun violence is a scourge in our city, and we see it every single day. We have lost far too many lives over the years to senseless violence. And I can tell you, my office has always made it a priority to attempt to reduce that. But our overall violence reduction strategy also involves the work that has already been taking place, as the mayor has indicated. We're already underway to remove guns from our streets in the Western District. These neighborhoods have seen the highest rates of gun violence over the past few years, and the plan is to implement the strategy in other parts of our city now. My office has dedicated prosecutors working out of the Baltimore Community Intelligence Centers. We talked about these, a model of the Strategic Decision Support Centers in the Western District to combine our policing and prosecutorial efforts to identify crime patterns and do everything in our power to reduce shooting and homicides for the well-being of our communities. My data analysts, as we work with the commissioner on our crime plan and the one that he has introduced, also work hand in hand with the Baltimore Police Department and serving as case support for investigations through phone recording analysis, target workups, social network analysis, requesting administrative subpoenas, mapping tracking devices, criminal support, networking locations, and engaging in other analytical tasks as the investigation requires. All intelligence products are then shared with the DEA and ATF and our federal counterparts. See, it's by working together we will continue to gather information about the groups who perpetrate the gun violence in our communities. At the same time, we recognize that the causes of gun violence are multifaceted. Incarceration is a tool, but it cannot be the only tool. My community liaisons assigned to the Western Districts work with community members, organizations, and businesses to further provide information about individuals driving crime in that particular neighborhood. They also help to identify respected voices in the community, like Mr. C, that can specifically influence negative criminal behavior and deter it through community efforts and diversion rather than just incarceration. This plan that, again, our mayor has introduced, this comprehensive plan, it is through partnership that we can work together to eradicate the violence in our city and in our streets, and the progress that we seek in our communities so desperately deserve. It is without a doubt a groundbreaking and innovative method to tackling crime, but we cannot just use the hammer of the justice system. We have to strengthen the relationship between the community and our law enforcement. And that's why I applaud the mayor for dedicating serious funding to this project, including millions of dollars, which hasn't been done before, for intelligence centers to analyze police data on shootings, and more funding for ROCA to interrupt cycles of violence. This approach is part of a larger effort to be smart on crime and respond to the new realities that we face in a post-George Floyd world. The mayor and BPD have my backing on their 911 diversion program and on the consent decree, and I'm grateful for their support when it comes to not prosecuting minor offenses. This strategy and partnership is enabling us to focus our limited resources on more serious crime like gun crime, and I will have more to say on resources soon. But citizens want and deserve real solutions, best achieved by collaboration and partnership between the community and law enforcement to remove serious crime from our streets, and that is what you're getting today.
Thank you, Madam State's Attorney. We will now hear from our U.S. Senator, Senator Chris Van Hollen. Mr. Senator?
Thank you, Mr. Mayor. Well, thank you, Mr. Mayor, and it's great to be here with Mayor Scott and Team Baltimore to join together to announce the mayor's plan, Baltimore's plan, to confront violence. And we all know this is an urgent priority, and it's something that needs to be done in a comprehensive manner. As the mayor said and others have said, there is no one answer to violence. There's no one single policy that will address violence. You need a comprehensive strategy. You need a sustained strategy. You need a unified strategy. You need everybody together, all of government, all of community, all of neighborhood. And what the mayor has done here is, rather than a top-down city hall approach, it's a listening to neighborhoods up approach. And we're going to be working together to make sure we implement this. There are three major prongs, as I see it, to addressing this issue. One is prevention. And that begins at the beginning, meaning with very early education. I'm really pleased to be working with my colleague, Senator Cardin, and our members of Congress, Dutch Ruppersberger, John Sarbanes, Kwasi Mfume, and others, as we work to implement President Biden's Build Back Better agenda. And the better part of that means we don't just return to the pre-pandemic status quo. We need to do a lot better across the board. And part of that plan is universal early education. Part of that plan is increasing funds for K through 12. Part of that plan is to make sure more people in Baltimore, in West Baltimore, East Baltimore, and around the country have an opportunity to succeed from the beginning. So prevention at the most basic level has got to be part of any plan. Then there's targeted prevention or intervention, and that's making sure we interrupt the cycle of violence by focusing on those who are most at risk, including people who have already gotten involved with the criminal justice system, including returning citizens, including people who have been injured by gunshots and are in the hospital. Those are all opportunities to intervene to stop the cycle of violence. And that is also a big part of the Biden agenda. And the mayor was just recently at the White House with the president as part of President Biden's community intervention with violence program to interrupt violence in communities. And Baltimore City is one of those cities that has agreed to spend some of its funds from the American Rescue Plan for the purpose of these community violence intervention programs. And they do work if you fund them on a sustained basis and you stick with it over time. And so the American Rescue Plan, which we passed in March, the members of Congress, together with the President and Vice President, is providing some of those resources. And President Biden has said, as part of his next piece of the Build Back Better agenda, he's provided $5 billion nationally for this purpose. And we want to get that passed as soon as possible to provide those additional resources to Baltimore City and other places around the country. so they can intervene and intervene at the community level. And then finally, of course, there is the enforcement piece, the prosecution piece, and we need to remember that we need to start by interrupting the gun traffickers. And we have been in conversations, and the mayor has, and the ATF, the Bureau of Alcohol, Tobacco, and Firearms, is going to be deploying more resources to help interrupt gun trafficking in Baltimore and in Maryland. At the federal level, you know, my House colleagues passed universal gun safety legislation to require a national plan to conduct background checks. Maryland's not an island. Over 50% of the guns used here in Baltimore City in crimes, well over 50%, come from out of Maryland, out of state, from guns that do not have as strict gun safety laws as the state of Maryland does. And so we need to do that at the national level. But as we work to do that, we also need to make sure the ATF has a director, David Shipman. We're trying to get that nomination confirmed in the United States Senate right now so that we can use the ATF to crack down on gun traffickers. And we also need to make sure that we're enforcing the law and prosecuting, as the commissioner and state's attorney said, violent crime. And I'm going to end with the mayor's 911 diversion program. Because this is something I've been working on at the federal level. Congresswoman Karen Bass and I introduced legislation some time ago to encourage cities and local jurisdictions to do 911 diversion programs. And that's for two reasons. One, so many of the calls that come in through 911 involve situations that don't require a police response. They're issues involving people with mental health challenges, people who are homeless, people with substance use disorders. And what we've seen is too often around the country, when you have a purely police response to those kind of situations, you see unnecessary escalation and unnecessary and unjust death, like the George Floyd case. And so the 911 diversion program, which the mayor implemented as one of the leaders in the country on this, makes sure that we have the right response to the right situation to avoid that unnecessary escalation. And it allows the commissioner and his force to focus their resources where they are needed in cracking down on violence and enforcing the law. So I want to just say to Team Baltimore, it's good to be with all of you today. It's good to be with Mr. C. It's good to be with Director Jackson. It's good to be with Commissioner Harrison, State's Attorney Mosby, our state senators and delegates, the council members. But it's Mayor Scott who's brought us all together, and I just want to thank him. And it is also Team Maryland at the federal level. Senator Cardin and I work very closely together, as we do with Congressman Rupersberger, Sarbanes, and Mfume. And Mr. Mayor and Team Baltimore, we're pleased to be part of your team. And we're going to be working very hard to continue to provide the federal resources you need to make sure this plan is sustained and successful. Thank you all very much for what you're doing.
Thank you, Senator. As I often brag to my fellow mayors around the country, no one has a federal delegation like ours. So we know that we have the best. And I have the privilege now of introducing my personal congressman, Congressman Dutch Rupersberger. Dutch?
Well, thank you. Mr. Mayor, thank you, and for pulling all of us together. I was in local government for 17 years, and one thing I liked about local government, you're closest to the people. But, you know, I'm now in federal government, and I have a different job, and our job is to really focus and work with the mayor on this great plan to get the resources that we need, and we need resources. Like, I understand our police department, it might be down 300 people. We not only have to hire people, we have to have background checks, we have to have good training, and that's real important to deal with the problem. But Mayor, thank you for having us here. It's great to be here, and look at the community people. That's what I like, right here in this area to deal with the problem. We have to take back our streets. We have to take back our communities. That's the most important thing to do for our kids, for our people that live there, our senior citizens. And that's part of what this plan is going to do. You know, I was listening to a talk radio show, and I'm not going to name the name, where they were talking about the city homicide rate and how for 6 years now, 300 murders, and how nothing's changed. Well, you know, it's changed. And by the way, I love the weather today too. That's changed. And so here we are coming together, federal, state, and local. Teamwork. You know, I grew up in the city. I went to City College. And is Bob Emery still here? He left. I mean, a person who's been so involved in this city and helping the issues. I really appreciate him coming. That's why I'm mentioning him. Anyhow, when you have 6 years, 300 plus murders, you've got to do something different. It isn't working, and we have to identify it. You have to learn from your past mistakes. Today, in announcing this new plan, Mayor Scott is acknowledging the previous efforts that have failed, that we need to try something that hasn't been tried before. This plan is first multi-year strategy to reduce violence in Baltimore City. It's the first time it treats violence as an urgent public health epidemic. Mayor Scott, as we told you last week, Baltimore's congressional delegation, including my friend John Sarbanes, who's here today, Kwesi and Fumi, who had a change in the calendar. He just couldn't make it. We're so great to have Senator Van Hollen and Senator Cardin working with us. And by the way, I'm on the Appropriations Committee, so we get the money. And Chris is on the Appropriations Committee in the Senate. So that really helps when we get things passed in the House or they get things passed in the Senate, that Chris and I can work together for our citizens. And that's why he's really here today. And Chris, I appreciate all your words. Now, our work has already begun. The appropriations bill that cleared my committee on the House of Representatives, including funding that support the mayor's vision of violence, how we deal with violence in partnership with city residents, whether it be expanding the cities, and Chris Van Hollen talked about the 911 diversion plan so that we get citizens in crisis the care they need while freeing law enforcement to focus on violence. What does all that mean? That means basically that when you get constant 911 calls that really police shouldn't be answering, they need to focus and prioritize on crime. We're going to start helping people that need help. And by focusing on this, you watch how we change. It also helps in relationship between communities and police. And, you know, in a lot of neighborhoods and areas, the police aren't trusted. That's got to be turned around as quickly as we can. Strengthening programs like Safe Streets, great program. And a lot of people in Safe Streets have had their problems themselves. So they've lived those problems, and now they're dealing with those problems. I happen to represent Cherry Hill, and they have a great Safe Streets program there. And I think that's something that is building the foundation of where we want to go. Expanding hospital-based violation. Let me tell you, Maryland shock trauma is rated #1 in the world. Iraq, Afghanistan, they do the best work and research, and people come from all over the world to be trained here. And we have it here in Baltimore. It's such a resource. By the way, it saved my life 2 years ago. And so Maryland shock trauma had a program, and I give them credit, where they get people who come in and they're shot. And they sometimes see the same people over and over. And the docs say, next time you might die. And let us work with you. So while they're in the bed, they're almost captive because they're hurting and being taken care of. They start talking to them about, let us help you. Let us get you into another neighborhood. Let us work with you to get a job. Let us try to get you away from where you are, or your life could be over. And it worked. And it's grown and it's grown. And as a result of that, it's a national program started in Maryland shock trauma, and it works because a lot of people in crime, they're there for different reasons, but wherever they are, they're there. And we want to get them before they commit the crime where they're going to be in jail for a long time or where they're going to be killed. So we're really looking forward to that hospital-based program. And now, Mayor Scott, it's right that the problem requires all hands on deck. And State's Attorney Mosby, your speech, what it said to me, and it's really basic fundamentals in law enforcement, that we have to come together as a team, wherever we work or wherever we do, whether it's the mayor who's pulling this together, the state's attorney, the commissioner, and or the county council, and city council, excuse me, and by bringing people together, if you disagree on some philosophical issues, that's politics, that's light. But on the basics, we have to come together. And if that starts at that level, it'll go down, filter down into a lot of areas, including police. And that's where we need to go. It's about trust and relationships to work together to deal with this serious, serious problem. And believe me, it is really serious in this city. Now, federal, state, and local. And we also, we have the courts, the federal courts are working with us and on a team basis together. And, as a former prosecutor, I can tell you, you put together a team strike force of federal, state, and local. We're gonna do what we need to do. And the one thing that local doesn't have as much of, you got it. Anyhow, what's really, really good, the federal, state, and local, is that a lot of this is from out of state. And we don't have the money to follow somebody to Florida or wherever this is coming from. And so what we do when it's out of state, the feds have the money. And the mayor, the state's attorney, the commissioner know that we will work hard and our delegation to do whatever we need to do. In closing, I just want to say this. I'm just pleased what you've done here, Mr. Mayor. You have vision, but vision is the beginning. We now have to implement, and implementation is so important. We have to trust each other. We've got to work on the team concept of crime and helping to improve our streets and our citizens and save lives. With that, the state's attorney, the mayor, Harrison, the commissioner, they've agreed to talk teamwork, and I loved hearing that today all day long. If you listen to all the speeches, that's what we talk about. Now, also pleased to see members of where's Senator McRae? Did he come? Okay. You're always somewhere, so you do a good job, and we thank you for that. Also, City Council, Antonio Glover. Antonio, right beside me. You're watching my back, right? Okay. City's delegation in Annapolis, Delegates Chanel Branch and Stephanie Smith, thank you for what you do in Annapolis. Again, it's a federal, state, and local team, and that's what's going to make it work. The team effort, trust and relationships, and we're all proud to be a part of it. Chris and I are going to do whatever we can to get you the resources to do your job. Thank you.
And now we'll bring up Congressman Sarbanes.
Good morning, everybody. I will not speak long. Good morning, Mr. C. Good morning, the residents of the Rose Street community. Thank you for having us here today. Mr. Mayor, thank you for your vision on this comprehensive strategic plan. Director Jackson for putting it into effect, executing on the plan. This is an exciting day. It's another start. The state's attorney talked about how we've come together as a city many times. The question is, can this time be different? I feel it is different. I think this approach has elements to it. It goes deeper and broader than things that we've seen before, and that's why I think the opportunity for success is great. I wanted to just focus on one element of this, which is the public health lens. In other words, looking at gun violence, trying to lift up public safety, address trauma, but do that through the lens of public health. Increasingly, we are seeing this as a focus, a perspective nationally. The Centers for Disease Control have brought much more attention in the last few years to this idea of addressing violence, particularly gun violence, through the lens of public health. I sit on the Energy and Commerce Committee and the Health Subcommittee. We've had a lot of testimony about how when you do that, here's what happens. First of all, you collect data in a different way. You look for different kinds of data when you approach violence as a health challenge. And when you collect different data, it makes you creative in a different way. You bring a more systematic approach when you take the public health lens to the issue of gun violence. We've seen that at the national level. We're seeing it here now with this plan that the mayor and Director Jackson are putting forward. So, Mr. Mayor, I'm looking forward to the opportunity, actually, of helping the Centers for Disease Control, the Department of Health and Human Services, others at the federal level, lift up Baltimore as a model of how you address violence with a public health approach. I think this can be a template for what can succeed here in Baltimore, but more broadly across the country. So congratulations on this effort. We're excited about it. We stand together, as all have said today, shoulder to shoulder, federal, state, local, to make these changes and to lift up public safety here in the city of Baltimore. Thank you all very much.
Thank you. I want to thank everyone who joined us today for being here from the federal, state, and local level. Want everyone to know that you can review the plan at mayor.baltimorecity.gov by just simply clicking a violence prevention plan. And with that, we'll take a few questions. And since I haven't seen you in so long, Mr. Fenton, let's have you go first.
And just real quick, I know we kind of went a little over on time. Fortunately we have 2 more stops on the way, so tons of times for questions. So if we could, just for respect for everyone's time, keep it to 2 questions per outlet. But again, we're going to have 2 more stops on the way. So there you go.
Nobody? I'm shocked, Mr. Fenton. Oh, he's up at the mic, Kate.
Hey, can you talk to us about some of the key metrics that you're going to use to identify success in this plan?
Yeah, and I'll let Director Jackson go into the deep data details. But of course, first and foremost, it's about actually seeing the reduction, right? If we see the numbers go down, that's an important thing. It's also for us about how our residents feel, the perception of safety, which we will be doing. When you think about when we talk about reentry, right? It's about how many of those folks that we are through our reentry program are getting jobs. How many of them are not going back? How many of them are not dying over the few years after they come home? We have to think about this in a very robust way. We have key statistics and data that we will be doing in a very data-driven way. I'll let Director Jackson chime in about other key specific ones.
Thank you, sir. What's your name?
Kendall.
Kendall. Thanks for your
Kendall.
question.
Kendall.
Kendall. Thanks for your question, Kendall. So first, I'd invite folks to make sure that you're with us when we are at Coppin State University talking about Pillar 3 around data and evaluation and accountability. But because of Dr. DeRosa's approach, when given the mandate to convene the Violence Prevention Task Force, was associated with making sure that there were real outcomes and impacts and measures a part of this approach. We're pretty well prepared for what those measures, those key performance indicators need to be and what they're going to be. We'll be working with the Mayor's Office of Performance and Innovation to not only hold my office accountable, but to hold BPD accountable and other city agencies accountable for those reductions in homicide and for perceptions of community safety and trust between residents and BPD officers.
Kate?
Thank you, and thank you, Justin, for giving me your slot. I'm Kate Amara from WBAL TV, and I have some housekeeping questions. I don't know if you can answer for all 3 pillars or just one, but how long will it take to fully implement the plan? What is the additional cost? Where's the money coming from? And since this is such a new thing for a city that has had this issue for so long, are you having any problems with buy-in from whether it's city agencies or employees? Pillar 1, 2, or 3.
Well, I'll start with your last point. The city agencies employees follow my direction. They have to understand that the direction I give, the direction that we're going to go. And if you're not bought into this, then there's somewhere else that you can go work. But more importantly, this again is a 5-year plan. We are expecting to see results over that 5-year plan, starting, of course, with the first year implementation. We know this will be funded. This will be funded in many different ways. You heard our federal partners talk about their willingness to help us fund it. We ourselves in city will be making sure that we're reprioritizing funding to make sure that we do this in a very significant way. We all know that we've already committed, as you heard from our senator, that Baltimore is a part of the president's community violence interruption network. So we're going to be committed to using ARP money to do this as well.
So just to clarify, so the first year of the 5 will be implementation, and then we'll start to see.
No, I'll let Director Jackson go into the details. It's about it's multi-year, and there's implementation, and also it's key, Kate, that we're going to be adapting as we go throughout. We're required by law to update the city council at least every 2 years. So we're going to be adapting and changing. We will not refuse to evolve as we go throughout this plan. Director?
Thank you.
Yes, sir. Thanks for your question, Kate. The violence prevention plan will also include a timeline. So it does include the timeline across the 5 years, and you all have heard the mayor mention often that our first year is the foundational year. If you imagine pouring a house, we're reconstructing, we're creating the system that we want to live in. So year one's going to be a foundational year. That means that we're going to be defining and staffing the work. We're going to be building the infrastructure to support it, that we're going to be making sure that all agencies are aligned. We're going to be executing a lot of proofs of concept. We're dealing with adaptive challenges here. And so we've got to be ready to iterate and to pilot things and then scale them up pretty quickly. Year two is what I'm calling a framing year. Year three is securing it. You can tell my dad's a general contractor, right? Year four is the finishing year, and year five is the maintenance year. I want to be clear in saying that we're not finished in year five. We will see significant reductions in the homicides and the shootings in our city. We will see increased perceptions of safety and trust. And we will continue to have work to do. So the timeline for the first year is included in the plan.
Thank you. Thank you.
Dan?
Mr. Mayor, I'll be quick because I know one of my colleagues has a question as well, but I have a two-parter for the state's attorney, if she'd allow it. I have a question first about the accountability factor of this plan and how you hope to hold repeat violent offenders more accountable working with the police department. That's on the plan, and the second part of my question is yesterday during the consent decree hearing, there was some concerns raised by the judge about some of your minor offense policies and that interfering possibly and causing some confusion among implementing the consent decree and coming into compliance. Do you have any concerns there?
So first and foremost, I think accountability is key, and I think that we're all on the same page, and we want to focus on violent crime. That's one of the reasons for my policies and coming out and basically saying that these minor offenses. Yesterday's hearing, you asked me about that with regard to the consent decree, and I'm almost certain that Judge Bradar, in recognizing that there are staff shortages in the police department, that it's a resource issue, right? And so we can't be counterproductive to the limited resources that we have, and the mayor, the commissioner, and I all agree that those limited resources should be focused on violent crime. And that's what we did pre-pandemic. If you look at our conviction rates, we went after bad guys. If you look at the public enemy number ones that were at one point a flashpoint for the police department, we convicted every single one of them with the exception of 2. So accountability is key, and we'll continue to focus on that. With regard to the second prong and the rationale for the policies is the fact that we want to base our decisions on data. That's what this is all about, a unified, data-driven approach. And when you look at the data, we made our policies permanent based on the numbers. And so the last but certainly not least factor that we considered, and I'm sure that Judge Bradar has taken note in overseeing the consent decree, is that unfortunately we have had a number of failed policies of zero tolerance policing and broken windows theory, where we focus on these minor offenses, but for people of color in this country, it can lead to a death sentence. So we are attempting to lessen that engagement that unnecessary engagement among police and communities. And so I would stand here and I would tell you, yes, you'll get that accountability the same way that you did before. We work with our partners in the Baltimore Police Department, which is why the commissioner, the mayor, and I are all on the same page. Thank you.
Emily?
Mayor, you set a goal of reducing violent crime by 15% annually. If you multiply that out through 2026, you're going to be at rates that haven't really been seen in Baltimore since the 80s. So how did you come across that figure? How did you reach that goal, and do you think it's realistic?
I do think it's realistic. Emily, when you think about even though we know some atrocious things were happening in that period with what's known as the Gun Trace Task Force, or what Mr. Fenton and I would know as the Violent Crime Impact Section, when you think about the reductions that we've seen before in Baltimore over time, we know that it can happen. And it definitely can happen when we're not just doing it solely through a lens of policing, when we're thinking about how we prevent, how we invest, how we nurture and foster community relationships. That's how we have to aspire to something. We don't just wake up every day and say, well, oh, we're just going to say we're going to reduce it. No, you set a goal and you hold everyone accountable to that. I grew up running track. My first goal was to run a mile in under 5 minutes. And then after that, wanted to talk off some more. I didn't just go out there to do it. You set goals and you push everybody that works with you and alongside you and underneath you to go towards those goals, because that's what Baltimore needs. Baltimore needs people who want to push it to be the best version of itself, not just expect that it's going to come. Alexa?
Hi. During yesterday's consent decree hearing, the city solicitor discussed the formal request for federal officers to be brought here into Baltimore. Do you support that, and how does it fit into your crime plan?
Well, again, we know, Alexa, that any request like that has to originate with me. And we have a wonderful partnership with our federal partners. Before I went to the White House, I think I've told you this before, I met with our local ATF agent in charge along with the police commissioner. I actually, of course, met with the president. We talked about gun trafficking and the need for ATF to be supporting and helping cities. You heard from our senator and our congresspeople about how that's happening. So, yes, I support it. We have a great partnership with our federal law enforcement partners, and we're looking forward to having that grow to deal with the issues on the city level.
Thank you.
Thank you, everybody.
Thank you.